Hi there. I'm the digital double of Dr. Ghiassi who instructed me to assist you with questions you may have about your upcoming carpal tunnel surgery. Any information I have for you has been carefully curated by Dr. Ghiassi himself. You can ask me questions by using the keyboard or just by speaking directly to me. When you're done talking, simply tap the microphone icon. Now, how can I help you?
Okay, so what can I ask you?
You can ask me questions that you may already have asked Dr. Ghiassi about your upcoming surgery, or new questions. Typically, people ask me about things like what to expect during the surgery or during the healing process.
¿Hablas español?
I don't speak Spanish as well as Dr. Ghiassi. It's best if we stick to English.
How can I schedule an appointment with Dr. Ghiassi?
You can reach Dr. Ghiassi by phone or email. Please choose the option below that suits you best.
Will I have to wait long to make an appointment?
You will not have to wait long when making an appointment. Most often, we can see you the next day, and we can certainly see you in the same week. Depending on the condition, we may even be able to see you the same day as well. Our normal office hours are Tuesdays and Thursdays. Dr. Ghiassi performs surgeries Mondays, Wednesdays, and Fridays.
So I do have some questions about the surgery. First off, what does the operating room look like for the carpal tunnel surgery?
People are often curious about this. Here's a brief video to introduce you to our operating room.
Put that under your knees. Okay. And we have a blanket for you.
Yeah, they did a blanket. They have to, there's one on,
Play some
there's
music.
one in Brentwood.
I went to one in the valley, Nigel's. It's like a big makeup.
Is there an alternative to surgery?
The current literature suggests that bracing and corticosteroid injections may be useful in the non-surgical treatment of carpal tunnel syndrome, although the benefits may be short-term. Other non-surgical options such as occupational therapy and ultrasound have not been shown to be effective for this condition.
About anesthesia, what do most people choose?
I would say about 50% of patients choose local anesthesia for carpal tunnel surgery. It all depends on your level of anxiety. If you're anxious or have phobia of needles, hospitals, or doctors, then it might be a good idea to think about sedation for your surgery.
Why would I choose local anesthesia?
Choosing local anesthesia is simply a lot more convenient for you. There's no pre-op evaluation needed by your regular doctor, no IVs, and no need to fast the night before your procedure. Patients who choose local anesthesia may even be able to drive themselves to and from the surgery center.
And if I chose full anesthesia, how will I be put to sleep?
During sedation, an anesthesiologist administers a small amount of intravenous medication to the patient to help them relax for a procedure. Another term is twilight anesthesia. Patients are in a deep state of sleep and normal bodily functions such as breathing and heart function are not affected.
Okay, I have some questions about what happens post-surgery. What will I be able to do after the surgery?
You will be able to do many things after your procedure, such as feed yourself, dress yourself, talk on the phone, type, do light household chores, cook, drive, and engage in light exercise. But you should avoid prolonged moisture. If your dressing gets wet, you should change it. Having a wet dressing is like wearing a wet sock. Moisture can delay healing and beat up the skin.
Can I take a shower soon after?
You'll be able to bathe after the procedure. Most patients cover the dressing with a plastic bag and use a couple of rubber bands to keep it dry. Alternatively, you can buy a cast or dressing covers at your local drugstore, or use the link below to order from Amazon. It's a little expensive, but if you don't have help at home, it's worth it.
Also, how do I sleep at night?
You can sleep with several pillows to support your hand, as shown here.
What does a normally healing incision look like?
It's natural to have questions about the healing process. Here's an image of a normally healing incision 7 days after the procedure.
How can I tell if my stitches are infected or not?
Luckily, infections are rare with a risk of under 1%. If you're concerned, you can always look at your incision. If you think you have an infection, please call Dr. Ghiassi or go to your local urgent care.
When can I get my stitches out?
Your stitches typically can be removed after 10 to 12 days.
What can I do for the pain?
Elevating the hand above your heart helps reduce swelling and minimizes the pain. You don't have to do it continuously, but if you're feeling pain and/or throbbing, it's your body telling you to elevate your hand above your heart. Try not to use a sling and avoid tight bandages, as they can also be painful.
Can I take over-the-counter meds for pain afterwards?
The majority of my patients do not take any narcotic pain medication. Tylenol arthritis, Aleve, and 1 gram of magnesium can be very helpful. I tell my patients to start on their pain medication the night before the procedure and have them take it on an around-the-clock basis for the first 2 days after the procedure. Below is a link for the medication on Amazon.
So will I need physical therapy to get back to normal?
Generally, most patients perform home therapy. Here's a set of instructions on how to do home therapy. If your motion is limited at the first visit, or if the incision is very sore, we generally have a certified hand therapist work with you.
Finally, I want to make sure to cover the insurance question. What insurance do you accept?
Dr. Ghiassi accepts Medicare insurance. However, he's not in network with other insurance companies. As a courtesy, his office will bill the insurance company on your behalf.
Okay, I guess that's it for the time being. Thank you.
No problem. Is there anything more you'd like to ask me? If not, simply say goodbye to end the session.
Goodbye.
Goodbye. It was nice speaking with you. Please feel free to visit me again if any additional questions should arise.